My name is April Kessler. This is for Nursing 104, our first scenario. This will be actually my daughter's my patient. She just turned 18, so this is my Mother's Day present from her. Okay, so I'm going to start this scenario by introducing myself. Hi, my name's April. I'm going to be your nurse today. We're going to be assessing you. Can you tell me your name and date of birth?
Katie Grace Arianis, and the date of birth is 03/01/03.
Okay. And do you have any allergies?
No.
Okay. Also, do you have any religious or things that we need to consider, cultural things that we need to consider? No? Okay. So we're going to start with hand hygiene. Okay. Have you noticed anything abnormal that we need to address today?
No.
Okay. All right. Do you know what day it is?
I don't know what day it is.
Do you know what day of the week it is?
Sunday.
Okay. We have Sunday. Do you know what year it is?
2021.
Okay. Who's the president?
Biden.
Okay. All right. So she is oriented, neurals intact. We're going to start by a baseline set of vitals. We've assessed her neurological status. Okay, we're going to do oxygen, and this is going to read the pulse as well. However, I'm going to take and make sure that we have strong pulses and it measures what this says. Okay, we have strong radial pulses. Okay, I'm also going to be assessing her skin turgor, which looks good. I'm going to look at her cap refill. Almost immediately refills, less than 3. Okay, we are at a pulse of 88. I would agree with that. Oxygen of 98. Go ahead and uncross your legs and relax your arm. (125/85). Okay, and while I'm over here by this side, I'm going to be using an apical pulse, which is a little bit higher up on her arm. It'll be right here at her 5th intercostal space. Go ahead and relax your arm. We've already confirmed that she has a good, strong, and regular radial pulse. We have a very strong apical pulse as well. We have a pulse of actually 82, and we have a respiratory rate of 14. So now we're going to move into the rest of our assessment. Okay, we're going to just kind of take a look at everything up here and make sure everything's good. I'm going to take a look at ears, make sure that we're at the same level and there's nothing funky coming out of them, or that they're the same size and in the same area. Okay, and open your mouth. Everything looks good there. And take a look at our neck. Okay, and move your hair out of the way. Okay, you're good. Okay, everything looks good here. All right, I'm going to assess her back while she's sitting. Okay. everything looks straight, go ahead and stand up. Okay, let your shoulders slump forward. Just kind of like, yeah, there we go. Okay, everything is symmetrical back here. All right, go ahead and have a seat. Next, I'm going to listen for lung sounds and heart tones. So first, I've got my lung sounds. Gonna move your hair again. Okay, we're gonna listen to the back, make sure that we have air movement in all lobes. Okay, and we're gonna check our pupils for response. Okay. Okay, we are equal, round, and reactive. I would like for you to squeeze my fingers. Okay, squeeze, squeeze. Very good. Okay, let go. All right, now I want you to close your eyes and I'm gonna touch you and you tell me where I'm touching you. Okay?
On my forearm. On my back. On my calf.
Okay. And all the while I'm assessing her mental status and her skin, turgor all over. We are, okay, so what we're gonna do next is have you lay back and I'm gonna assess your abdomen. Have you noticed any changes in bowel movements?
No.
Any burning while you're urinating?
No.
Any abnormal colored urine?
No.
Exceptionally dark? Anything like that? Okay. So I'm going to listen to bowel sounds now. Okay. Sounds were good. I've heard sounds in all quadrants. Now I'm gonna, is it okay if I lift your shirt? Okay, I'm gonna feel of your abdomen now. I'm gonna feel in all quadrants for masses or abnormalities. Okay, and I'm gonna check for symmetry on her chest wall as well as her abdomen. Okay, everything looks good. Go ahead and sit up. Okay, stay right like this. I'm gonna take a look at your back, okay? Okay. Everything looks normal and symmetrical. Okay, can I get you to stand up and take a couple of steps for me? Have you had any issues with balance or anything of that nature?
No.
Okay, can you walk to right here and turn around and walk back? Very good. Okay, if I could get you to lie down again, I'm gonna look at your legs. Okay, just gonna take off your shoes. Okay. Okay, she has a strong pedal pulse. Okay, how about your last period? When was that?
The middle of last month.
Okay, do you keep track of that regularly?
Yeah.
Okay, is it regular?
Yes.
Okay, any abnormalities in flow?
No.
Okay, so her legs look good. I don't see any edema. Her skin turgor is very good. Okay. So what I'm going to do, I want you to lift my hands. Okay, lift, 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 lift. Okay. Now I want you to push down. Okay. Now I want you to lift this leg. Okay. Now lift this leg. All right. Do you have any pain when you walk, stand, anything?
No.
No? Okay. You may sit up. Okay. So go ahead and have a seat again. All right. So we're going to talk about her newly prescribed birth control. Okay. So if you're having any abnormalities with your period, it would help to regulate your cycle to 28 days so that you have your 1 week of flow and then it stops. Do you have any questions as to how to use it?
No.
Okay, so it's very important to take it at the same time every day for full effect. Make sure your prescription is always filled. Hand hygiene again. And again, do you have any questions for me?
No, that should be good.
Okay, thank you.
Thank you.
And this concludes our patient assessment.